That's a good question. Hairy client. When you get, well, you could always do the 40-year-old virgin thing and wax them. I don't blame him. Shaving is horrible because then it grows back. It's terrible. I used to do full body waxings for people in Florida. It was, I could get these guys on and off the table in an hour and 15. And I waxed everything that was legal because they were athletes. They need, you know, cyclists. If they go down, the abrasion's even worse. The nice thing about the machine, it doesn't matter if they have hair. It will just glide right over it. With the manual equipment, if they get, you know, if you keep popping off, you just have to keep recreating suction, that's all. So this is a gliding movement. And the difference between me lifting and me pushing. So if you're on the table and you feel that person pushing, please tell them, lift the cup. Remind them, you're the only one who, we're going to be checking on you, but we might not catch it. So please make sure they know that. So I'm just gliding. You can do circular movements. You can pop it one hand to the other. Get creative with this. And when I was trained in the 80s, we were taught very different body mechanics than you all are now. So I do tend to move with the cups and have my own little joyride up here while I'm working. But I think it makes a difference in the movements. And I do try and keep the tubing off of them. It can tickle. So whatever you feel like doing with this.
You know, she doesn't look as puffy, I don't think, as she did when she first laid down.
I know. I like that. I'm happy to see that. So that was your gliding movement. You've also got the pumping that the machine does. But let's say you're across the room. Do it yourself. Suction and release, this is called. Let the machine do a lot of your pumping for you. It's going to make your life a lot easier. But sometimes you just got to do it yourself. The only thing I ask is that you don't stick your finger under here. She just got my fingernail, even though I don't have them. So please use the pad of your finger, or I just push the skin away. You can also switch, come in by the side, like this. Anything, as long as you're not, if I hear that noise, I'm going to be over at your table. This is a technique we show you in level 2, is popping, but is only for fascia. So you pop a glute, you actually separated tissue that should not have been separated, you're doing damage. So you got your glide, you got your suction and release or pumping that the machine will do for you. Now one of my other favorites is vibration. This stays in place. This doesn't move and you vibrate. Now our newer machine, the MC1000, has a patter function. You just put the cup there and you can see the skin going in it. It's just cool as heck. I love that one, but I love doing it myself too. Shaking, the cup moves. So it is moving over her, and when you pop off somebody, take notice. Very often it can be a restriction. So you'll see in our DVDs and in class, well, I can't edit it in class, but in DVDs we've left it in where I pop off of people. It's not a mistake, it's restriction. And every time I go right where her bra is starting, that's when I keep popping off of her. How's this feeling? So shake that sacrum out. Give them a little booty wiggle. So we did the gliding, we did the suction and release or pumping, we just did vibration, the cup stays in one place, shaking, the cup moves. You can anchor them. If you've got somebody with excess flesh, anchor it. Don't let that pull, the same as waxing. Anchor behind and move it. If you want a little, let's see if it'll illustrate. Now when I grab behind, you're going to see how much less tissue goes in the cup. When I don't grab behind, all of it comes with. So you can subtly regulate exactly how much you got going in there. If you've got somebody real sensitive, put your hands around the cup. You notice I did a little lift as I went. Can you feel the difference with my hands around it? So someone with fibromyalgia, you might be starting out like this. Most people don't even realize, you see I got arms on her and everything. They don't even realize I've got a cup on them. They can hear the machine, but actually that actually puts them to sleep. So, rolling rotation. Let's see. Epidural alley here. Rolling rotation. Popped off, that's restriction in that direction. So I just keep rolling it around to see that she's got restriction in every direction. Wow, that is impressive. So every once in a while, wipe your hands down a bit. Now I'm going to come in and I'm going to twist. Nice farting today, I have to say. This is good.